Chicagoans, families, and friends. This is your PC, the People's Counselor, sitting in for your favorite epidemiologist, Sister Simpson. And once again, we are here to bring you some information on what we call the health equity paradigm. And of course, we have been talking about this particular subject for the last year, maybe 2 years, because we think that it's vitally important that we learn and continue to push to get the things that we need. And for those of you that have been following us, you know that we have talked about this in the text, in which it means that we have to get involved on every level of our health, particularly from our families, our communities, our neighborhoods, and of course getting into some policy making decisions so that we can get the things that we need. So once again, this is Tacts, the Association of Clinical Trial Services, and we are bringing the science to the people. So I want to talk a little bit about not only the health equities piece, but we also want to talk about with diversity comes a cure. And of course that means that we got to get more people that look like us, particularly people of color, doing some things that's going to make sure that the elected officials, because as y'all know, we just got a new mayor, yay, right? But make sure that our elected officials are hearing us and making sure that they are doing things and putting policies and programs and resources in place so that we can have some of what we get rid of some of those, what we call those deserts, if you will, food deserts, access to treatment, whether it be medical or chemical dependency. And once again, I want to talk a little bit about that. But anyway, let me back up for a minute, because I am the People's Counselor, Charles Patton. All right. My primary role is to provide substance abuse treatment and intakes for people that have a substance abuse problem. If anybody been paying attention to the news, at least for the last 10 years or so, we have been dealing with what we call an opiate epidemic. And based on the literature, that started somewhere around 2006, maybe 2002, between 2002 2006, things started happening. And somewhere around 2012, we started seeing the numbers. And unfortunately, we have a lot of people that was dying as a result of opiate overdoses. So that's just one issue. All right. The other side of it is that we know that people of color are being disproportionately impacted by most social ills. When I'm talking social ills, I'm talking diabetes, hypertension. We got the sickle cell, which they're actually making some advances in, HIV. So there has been several issues that's disproportionately affecting black folks. All right, so I want to make sure that you guys hear me. And by the way, this is a call-in live show. So please call in, make your comments heard, ask some questions so that we can get you involved in this conversation. The number is 312-738-1060. Once again, that's 312-738-1060. And we are Tacts, the Association of Clinical Trial Services. All right, looking for your input, your comments, your suggestions. All right, let's move on to the next slide. All right. Now, I need to acknowledge some of our sponsors. And like I said, with diversity comes a cure. Increase diversity in clinical trials. Whoa, that's a biggie. But okay, I want to talk about CFAR, Men and Women in Prison Ministries, the AIDS Foundation of Chicago, the National Black Agendium Consortium, AHF, and of course my organization, which is Flow Photography and Enterprises. And once again, these are the people that help us to do what we do. Okay, so I want to thank you for allowing me to give you the introduction to this health equities paradigm. So it seems like we are going to make a transition because our favorite epidemiologist, Sister Simpson, has arrived, and I will let her continue this discussion with you and give you further information. And with that, see you on the next one.
Thank you. You don't have to stop it. Very good. Our favorite community counselor, people's counselor. How have you been? Good. I see we got a different setup for the studio. Very good. So as you saw, all the people that helped us sponsor us, and I'd like to thank you all for your patience. And welcome again to, this is a live show for CAN TV. We're Tacts, the Association of Clinical Trial Services, and I am Sister Ya, your favorite epidemiologist. Yes, it takes me a little bit of effort to get here, but thank you to be here. This is the month of April, and I have a few announcements that I love to make. One of the bigger announcements is a shout out to my daughter, our daughter Ajua Pryor. Ajua Sesato Sabia Pryor. Yes, I did say her full name, 'cause that's what mamas do, honey. That sister, that young lady, that 22-year-old, by the way, she just turned 22 March 31st. And on May 17th, she is graduating with her Bachelor's of Science degree in entrepreneurship from the School of Business at the Johnson & Wales University. Entrepreneur Magnum cum laude, honey. Yes! Not only did she go there, she slammed there. She didn't just come there, she showed up and she showed out, and she did the highest level of achievement that one can be at their university for her degree that she received, her Bachelor's of Science. I am so proud of her. Not only has she turned out to be a brilliant young lady, but she has turned out to really work on being, and she's working on it, being a first-class human being, a spiritual being having a human experience. She's went through a lot at her school. She had a lot of what we say the ebbs in the valley, but she showed out and flowed, none in spite of. And I want to make sure that I acknowledge that I know it was not easy achieving the feat that she has done. Many students go off to school. Our students, our children, our young people go off to many places. My daughter wanted to go to this school. She asked to go. This was her choice. This young lady has been on the honor roll since she was 6th grade. She has never failed from 6 to 7, 7 to 8, 8th to 9th grade high school, all the way through high school, and now through college. 3 years of college, 3 to 4 years, because she's actually started her master's program already. She has not missed a beat in being at the top of her class. Mama can't get no prouder than that. And her family members can't get any prouder than her guardian, her dad, her auntie, her uncles, everybody, her grandmother. We all want to say praises to Ajua Seshato Sabia Pryor, who is the daughter of Sister Ya Simpson. Yes, honey. And not only am I proud of this young lady, I am proud to be her mother. I go through those difficulties with being with a young person, a millennium, but it's all worth it because I not only think her future is bright, her present is bright, and I hope that she's in the moment. So thank you so much for allowing me to get that announcement out. It's been a wonderful, heartfelt approach to this, and I'm looking for more because now I'm gonna show her this later. I want that doctorate, honey. Speaking of which, I need to go back to school and finish my doctorate. So thank you again for allowing me to have this opportunity to say I am so blessed to have and be among this type of great people, young people who have moved forward, because the other one is Autumn Smith, who is the first young person I've mentored or matriculated. I did help with her practicum. She is the first one to ever become an epidemiologist just like me. Miss Autumn Smith, I'm so proud of you. She is now getting her epidemiology degree, her master's in public health and epidemiology degree with Loyola University's program, their certificate program. She has now finished and will also be graduating from Loyola University on May 7th. So guess what? I'm a busy camper, honey. Now she says I'm her mentor. Okay, fine. I hear that, but I'm her sister. She's a little younger than me, but nevertheless, I'm her sister, her oldest sister, and I just wanted her to do the right things that she wanted to do, and she did it. She got out of dental school. She didn't like it. She didn't feel it fit. She wanted to do public health, and she did it, and now she is graduating as an epidemiologist. How proud am I? So again, a shout out to Autumn Smith and of course my daughter Ajua Pryor. I'm so proud of both of these young ladies who are showing that not only is our present good, our future is bright. So that was a couple of notes that I definitely wanted to talk about. And you know, we always do our slides that we do with talking about health equity. I know I kind of jumped into it, but this is what this is all about, honey. You seeing these bikes, some of the bikes don't work for everybody, but get a bike that works for you and you can soar. That's what makes this particular picture so good, is because when you get the bike that fits you, your health is better, and when your health is better, you can soar. That is the benefit of having good health. We talk about it, we complain about it, we say it's hard. Nothing worth having is going to come easy. You will have to fight for it. And we're going to have to fight for our own health. Even me, I'm having to look more at a vegan diet, eat more plant-based. I have certain health ailments that I have to attend to. I have to take medication. I was told that I'll probably have to take medication for the rest of my life. Do I really believe that? I'm not sure if I believe it, but I do know that I'm going to be working on this body to make the body better. So that's why, honey, I do go out and I still dance. But that's part of who I am. It brings me joy, but the dancing is part of my exercise. And you have to find something that's exercise for you, brings you joy, and gives you that upliftment in life. And that's what this health is all about. I really want you to recognize that there are other people who are working through this concept of health equity, but you have to have it using health literacy. So in order to go from equality to liberation, we're going to need to be more literate. Now, I just worked on some data that I'll be presenting later on that had to look at literacy and health, if you want to say how well your health is, health outcomes. And unfortunately, people who have what we call high literacy, live in areas that are most hardship. In other words, they have economic hardship such as poverty, low income, low education. Obviously, all of those social determinants go together. They're into what we call an index called the economic hardship index, and I don't use correlation, but it's an ecological correlation to health literacy. And we were able to do for the first time and find out people in those areas are more likely to have high literacy. So what are we gonna do about it? We're gonna keep using CAN TV, and we're gonna keep training people to do better and be better. This is not the presentation that I wanted to show, but nevertheless, it's the one that's here. This was the one for International Day. It's not the one that I sent, but we wanted to talk a little bit about violence as prevention. I think this is going to help us to really start coining this term. When we say violence as prevention, we're really saying violence as a disease. Now, let me tell you something. I just went through a metamorphosis, and I want to thank, first of all, a mentor or someone who I admire, I want to follow, and that's Dr. Gail Frazier from the National Black AIDS Consortium. Revon Fellows is another brother that's with the National Black Agenda Consortium. I apologize for that. National Black Agenda Consortium, and we call it NBAC. That's probably why I'm not getting it right. NBAC. But NBAC has Dr. Gail Frazier is the president. Revon Fellows is part of that. We have a whole host of other people, including myself. myself, I work on the health elements for that group itself. And what we've been able to work with is another group from Reverend Anthony Williams, who wants violence. He wants the proclamation for violence as a disease. Now, let me tell you the story here. When they first asked me to come and be a part of their team and talk about it, let me be clear with you. I was not supportive of violence as a disease, because in my background, it's not a disease. But guess what? This is what makes science such a beautiful transition. I love science because science is meant to be proving you wrong. Facts become facts because someone makes it factual over time. And as that facts change, you begin to change with it. The one thing science is prove me wrong. Well, guess what, people? They proved me wrong. Violence is a disease. And we're going to talk a little bit more of why it's a disease. The construct for this was found through the definitions of redefining what disease means and the impact it has on an individual or group, of course, of the population, which is what I do. Epidemiologists don't look at individuals, we look at populations. So for one, disease, is a population. Infectious disease is what I specialize in, but diseases are among populations. So I have to look at that and see what are the trends, if we want to say, what is the reason, the causing, the agent, what is making this happen? So it's an impact on a population. And in this case, it is violence. Can you get your mind around that? Violence happening all throughout the city of Chicago. Mostly in the south and west sides and very concentrated areas of the Black and Latino areas in Chicago. So it's impacted a population, which is my realm of science. And then on top of that, when we talk about the impact it has on individuals, the other construct is we say disease, and then we say, okay, what is the condition of that disease to the people? And the condition is that it is obtrusive, it is abusive, and it's making people's physical bodies either, obviously, people die from it or they get injuries from it. So knowing what a disease is, and we're looking at violence for what it is. Violence is physical. It's also mental. It's very destructive to the brain. We also have people that talk about post-traumatic PTSD. Well, what we're also saying is violence is CTSD, as in current traumatic stress. So it's not post-traumatic stress, it's current traumatic stress. And because of that trauma that is placing on people, youth, seniors, adults, all people, but mostly in the Black and Latino areas, because of that physical and mental being. So we have the violence being defined, we have disease being defined, and when we add those two together, we've now come up with a construct that this is being imparted on a population of people, and it is physical, and it is having an impact on their psyche, on their mental, their physical, and we will say spiritual health, but that's our construct. You may say mental health. So all of those things are embedded there. We have people who are continuing to have emotional stress just from the violence itself. And because this stress is traumatic, it is considered a disease. So how do we work with diseases? We first of all understand what causes the disease. And what is causing this particular disease is specifically the types of behavior from people who have gone through a physical and mental trauma. Hurt people hurt people. So people who have survived this are not only the quote unquote victims. I don't like the word victims, but you understand we use that term to denote the person who received it, and then they use the word perpetrator to denote the person who put it out, who did it. And those two people go through a traumatic experience. So our approach is we talk about the survivors, and survivors include perpetrators and they include victims, but those survivors are still in our communities. So if hurt people are continuing to hurt people, and then people are experiencing what we're calling current traumatic stress syndrome. So it's not PTSD, it's C, current traumatic stress syndrome. So when we talk about that, now we're developing what we call cultivating an aura of people who are continuing to hurt others because they're hurt. So we must break the cycle. So if we have a disease, how do we go from disease to cure? Now, I don't know if we'll ever cure violence as a whole, but there is ways to talk about squelching it. There is ways to talk about containing it. It is ways to go to a level that should be so low that it's a way of life to not be impacted by violence instead of being the way of life to be impacted. Can that happen for real? Yes, I think there's a way to happen. I think historically Africans have shown in other parts when we were more antiquitous, before we were invaded by other cultures, that there were ways that we did deal with violent acts. But those cultures had invaded us, and then once they invaded us, we invaded ourselves, and then hurt people hurt people. So what we're trying to model is if hurt people, then healed people can heal people. Are you a healer? We are ready for healers. The survivors can become healers. The people who have been the witnesses of this traumatic acts can become healers. We are all in the position to become healers because healed people can heal people. If you're not a hurt person and you've healed your hurt, you can help heal the others. And that's the trajectory we want to take with violence as a disease. I want to thank you again for having this opportunity to show you what we're working with. I am Sister Ya. Be looking out for the Women's Networking Social. If you want to contact us about more information, I want to give a shout out to the People's Counselor, Mr. Charles Patton, our Vice President, and you can see our information is there. But the Women's Networking Social is on, honey. We are on for Thursday, May 30th. We will be having our 9th annual Women's Networking Social at the Oakwood Shores Apartment Complex Community Center. I will give you more information of where it's exactly located off of 38th and Vincennes, but more importantly, we are on. I hope to see you further at that particular event. Tell people it's free of charge. I want you to come, be a part of us, network with us, uplift, and become healers. Thank you so much for joining us. Shout out to everybody who has made this program what it is today. And we are so joyous of our young people. Ashe.